Top of the morning, Dan and Amy. A fascinating piece in the New York Post. Eric Spitznagel, who, among other things, talks to our friend Jeffrey Tucker from the American Institute for Economic Research, but and Fee as well. But here's the thing: comparing what the response was in America during the pandemic of 68, 69 compared to today. The pandemic of H3N2, or the Hong Kong flu, as it was known, the impact against the backdrop of Vietnam, against the backdrop of Woodstock and sexual revolution, all those things happening. Schools were not shut down, other than a few dozen because of too many sick teachers. Face masks weren't required, even common. It started in March 69, didn't flare up again until November of that year. Woodstock went forward, right?
Oh, that's right. Yeah, I was there.
Life continued as normal, said Jeffrey Tucker, but as with now, no one knew for certain how deadly the pandemic would turn out to be. Regardless, people went on with their lives. That generation approached viruses with calm rationality and intelligence. We left disease mitigation to medical professionals, individuals, and families, rather than politics, politicians, and government. Well, that's an interesting observation, isn't it? Both viruses, there's a lot of similarities. Both viruses spread quickly, cause upper respiratory symptoms, including fever, cough, shortness of breath. They infect mostly adults over 65 or those with comorbidities, but could strike people of any age. Both pandemics didn't spare the rich and famous. Didn't know this. Hitchcock actress Tallulah Bankhead and former CIA Director Alan Dulles succumbed to H3N2, that strain of the flu.
Really? I did not know that.
Mm-hmm.
But they didn't have any lockdowns. They didn't.
President Johnson, LBJ, and Vice President Humphrey both were infected with H3N2 and obviously recovered, much like Boris Johnson did, of COVID-19. And the media? The virus rarely made front-page news. A 1968 story in the AP warned that deaths caused by the Hong Kong flu more than doubled across the nation in the third week of December, but the story was on page 24.
Wow.
The New York Post didn't publish any stories about the pandemic in 1968, and in 1969, coverage was mostly minor, like reports of newly married couples delaying honeymoons because of the virus, and the Yonkers police force calling in sick with the Hong Kong flu during wage negotiations. A vaccine was soon developed in August of 69, but the news of the cure didn't get much media attention either. It may seem like the world responded to the 68 pandemic with a shrug of indifference, but the different approaches may be down to a generational divide. In 1968, we were confident with all the advances in medicine. Measles, mumps, chickenpox, scarlet fever, polio had all been brought under control, said Tucker. And so perhaps there was less politics and more confidence in the medical and public health sectors. And then there's this, too. The social distancing thing.
Yeah.
Much of our current thinking about infectious disease in the modern era changed because of the SARS outbreak in 2003, which scared the hell out of many people. It's the first time I recall people wearing masks and trying to distance themselves from others, particularly in situations where someone might cough or sneeze. The idea that a pandemic could be controlled with social distancing and public lockdowns is a relatively new one, Jeffrey Tucker noted. It was first suggested in a 2006 study by New Mexico scientist Robert Glass, who got the idea from his 14-year-old daughter's science project.
Oh. All right.
A 14-year-old science project in 2006 is
now the way we live.
Is now
in
why
2020.
Is why we're doing what we're doing 14 years later? Are you fracking kidding me?
Oh my God! I hope she got an A on that project. Whew.
Two government doctors, not even epidemiologists, Richard Hatchett and Carter Mecker, who worked in the Bush administration, hatched the idea of using government-enforced social distancing and hope to try it out on the next virus. We are, in effect, said Jeffrey Tucker, part of a grand social experiment. The cultural, the generational divide, the cultural change that has us responding the way we are today as compared to the way that the baby boomers responded in the late 60s to the H3N2. And remember, as of now, the H3N2 took more lives than COVID-19. And COVID-19 has a long way to go to catch H3N2. Not that I'm rooting for it, obviously, but
No.
remember, because you're talking about north of 100,000 lives it took in 68, 69. And that was when America had 2/3 of the population it does today. Remarkable. And so it's also remarkable to watch how we're reacting to people who don't follow the U.S. model, or particularly the blue state model in the U.S. And for more on this, we're pleased to be joined by Frederick Erickson. He is a Swedish economist and writer, director of the European Center for International Political Economy, and co-author of The Innovation Illusion, How So Little is Created by So Many Working So Hard. Frederick Erickson, thanks so much for joining us. Appreciate it.
Thanks. Good morning.
Good morning. So the Swedish model, it has gotten a lot of review and a good deal of support from experts, epidemiologists, not just Swedish epidemiologists, but others. And yet we haven't seen it replicated in too many countries. Why do you think that is?
I think the main reason is that a lot of governments just panicked and they decided to basically copy what China had done when we had that first outbreak of coronavirus in Wuhan in the beginning of the year. When the whole thing came to Europe and governments started to see sort of what happened in northern Italy, where hospitals were overwhelmed, where they couldn't take care of patients that arrived, everyone just freaked out and decided to basically, go for very, very strict lockdowns, basically locking people up in their homes and then try to figure out what on earth to do, while people were in their confinement.
And so, as you're looking at and suggesting that most governments reacted out of fear, and then, I mean, this is sort of more political analysis than it is economics. But why do they persist when the dire predictions did not materialize? Not just on deaths, but on hospitalizations, even. And I mean, is it just all chalked up to say, like, once we got in, we need political cover to get out, and so our political cover is yes, except the dire predictions didn't come true, but that's only because of what we did, and that's why we need to keep doing it.
Yeah, and I think it's also because the perception about what we were doing changed after a while. I mean, if you remember, sort of the first three-word slogan that everyone was using was basically to flatten the curve, to reduce the number of infected people in order to make sure that hospitals could cope. And that was the initial ambition, to avoid the situation that they had in northern Italy and the situation that they a little bit later had in Spain, where it was simply just impossible for hospitals to take care of all the patients that came in. But after a while, perception started to change, and suddenly it was not just about flattening the curve or protecting hospitals. It was also about trying to engineer something where you would basically root out the virus entirely in order to avoid the death toll to rise. So as time moved on, governments found it very, very difficult to respond to that change in sentiment. In many countries, governments were actually egged on by opinion polls to go for even stronger measures because people gradually got scared when they were locked up in their homes and didn't go out. So I think that's the first part. But the second part is that when you go for a method like this, you basically lock people up in their homes and you create this panic. It's going to be extraordinarily difficult to move out of a method like that because the virus is not going to go away. It's still going to be around us. Whatever method we're going to choose, we will have to live with the virus in the future. But now governments have basically engineered this perception that it's dangerous to go out. You shouldn't socialize with other people because you may get exposed to the virus. So it gets very difficult to back out from a lockdown policy once you have introduced it. That's the problem they have in, for instance, the United Kingdom right now, all the indicators suggest that they should take away the restrictions and get life and society to go on again. But the government is afraid of stoking a reaction among people who are afraid of going out.
Well, Eric, how is life in Sweden right now? I mean, what is your death toll reasonable to other countries nearby?
Well, our death toll is substantially higher than in countries like Norway, Denmark, and Finland, and they are the usual ones that we got compared to. But it's lower than, even if we put it in relative terms, so we compare it to the size of our population, it's substantially lower than in, for instance, United Kingdom, France, Belgium, let alone Italy and Spain. We're about sort of in the middle of the European average, along with the Netherlands, Ireland, and Switzerland. So that's roughly where we are. The main reason behind the high death toll in Sweden is that the government didn't succeed in what was sort of the main mission behind the few restrictions we had, which was to protect nursing homes from the virus. So we have roughly 75% of all people that have died because of the virus in Sweden. They are residents in nursing homes, they were residents in nursing homes, or they were elderly people that had home care. So that's where the Swedish policy had failed and where some other countries have been more successful. But generally, it's an experience that we share with a lot of other countries, that this is a virus which has been taking a lot of lives in nursing homes.
A lot of weight has been given to the R0 number, the rate of infection, the multiplier. And you've tracked this in Sweden, too, because while what you're describing right now is the case, this is about being forward-looking, too. So who will ultimately have had the best model that should be replicated in the future? So give us some of the indications of trend lines for Stockholm and for Sweden, because there are some who are suggesting, including Swedish state epidemiologists, that that Stockholm will be the first major city to achieve herd immunity, and that will mean that over the long term, say the next 12 months, Sweden will turn out to have had the one of the lower fatality rates than in the West, as opposed to where it is now.
Well, that may end up to be the case, but we don't know that yet. There is no credible information about how much the virus has spread in Stockholm or in other parts of the country. The few small surveys that have been done on antibodies in Stockholm suggest that we're roughly in the region of 20% of the population that have had the virus over the last couple of weeks and months. Whether that's going to lead us to herd immunity or some degree of immunity anytime soon, that's very difficult to say. I mean, there's so much we don't know about this particular virus, how fast it spread, for instance. And we also had, even if we didn't have sort of a government-mandated lockdown or government-mandated social distancing, people, have been careful. And we have avoided to be in crowded places. People have worked from home. So it's only natural that the rate at which the virus spreads also have been reduced as a consequence of the carefulness that people have shown. So for the time being, we don't know. The data we have on the R number basically suggests that it's been below 1 ever since the middle of April in Sweden, and that's been on a declining path since basically the sort of April 20, April 21st, roughly since then. So the expectation is that the reproduction rate has clearly slowed down as we moved into May.
Well, so that's what's interesting, too. And look, I know Dr. John Lee, who's a British pathologist, suggests the R0 number is about as valuable as a weather prediction. It's sort of unknowable. This is all sort of inexact, and there's a lot of unknowns here. But R0 is being used sort of like death toll to make all kinds of policy decisions, so it requires discussion. So, for example, our governor in the state of Illinois keeps referring to the R0 number, and we need to, get below 1 and stay below 1, and we're in a draconian lockdown protocol. Whereas Sweden, as you mentioned, is below that magic, 1 R0 number for some time, and they've taken a very different approach. Obviously, as a country, that's a about the size of Illinois population-wise. So it's just interesting to see where Sweden is on one of the metrics that's being bandied about, taking the approach that they've taken versus where a state like Illinois is with the approach that we've taken.
Oh, absolutely. And I mean, in my view, it doesn't make sense to use the R number as the basis for any policy decision you make.
Don't tell
Of
Governor
course.
Pritzker that.
Yeah, that's everything
absolutely.
to us.
No, indeed. I mean, it makes sense to keep track of the reproduction rate for sure, but the R number it's not something you observe, it's something that you estimate. And there are a lot of assumptions, a lot of guesswork to go into the model that you use in order to get to that R number. So everyone should be extraordinarily careful of using that as basis for policy or as a basis for trying to understand where the virus is. I think you need to focus on many other indicators to understand how this virus develops. So, for instance, if you look at Germany has started to ease its way out of its lockdown now, and it keeps track of the R number, but it hasn't outsourced its policy to the public health agency or anyone else who estimates that number. It's rather go for sort of a more simple type of indicator, which is that if they, during a week, will have more than 50 people per 100,000 population getting infected by the virus, then alarm bells will go off, and then they will start to talk about whether new restrictions or if old restrictions need to come back in any way. But that's a different way of looking at it than using the R number.
He is Frederick Erickson, Swedish economist and writer, director of the European Center for International Political Economy, and co-author of The Innovation Illusion, How So Little is Created by So Many Working So Hard. Frederick Erickson, thanks so much for joining us. Appreciate it.
Thank you.
Take care.
Yeah, tack so mycket. And he joined us on our turnkey.pro answer line.
The more you listen, the more you'll know. This is Chicago's Morning Answer. Morning Answer on AM 560. The Answer.
The Lou Dobbs Financial Report is brought to you by Signature Bank, helping local businesses succeed. Visit signaturebank.bank for your commercial banking needs.
I'm Lou Dobbs. The United Auto Workers Union heads back to work today in Detroit. Facebook buying graphics platform Giphy for about $400 million. America's beaches are open for business. Those stories next. You've all probably heard of asbestos and know that it's dangerous. And you may also know exposure to asbestos is the only known cause of mesothelioma, a deadly cancer. People who were exposed to asbestos decades ago are being diagnosed to this day with mesothelioma. That's because it can take as many as 30 or even 50 years to develop. But did you also know there's money to pay victims of asbestos exposure from years ago? An estimated $30 billion available to help compensate victims and their families. If you or a member of your family have been diagnosed with mesothelioma, you may be able to receive some of this money without ever going to court or filing a lawsuit. Get a free legal review today. Call Sokolov Law at 800-910-1950. That's 800-910-1950. After weeks of sitting on the sidelines,